So thank you so much for coming, and it's really a pleasure to have you. And so I'm just going to give you a brief introduction about yourself. And you're a consultant neurologist and neuro-ophthalmologist at Guy's and St Thomas's Hospital. You also work at Moorfield Hospital, Eye Hospital as well, with your neuro-ophthalmologist hats on. I'd like to talk to you about migraines today, and because I came across with your fantastic book, Break Free from Migraines Naturally. And so obviously the topic is near and dear to my heart, and because I have a personal history of myself, and just that I suffer from migraines for more than 20 years, I would say 20, 25 years, intractable migraines, but also I have an increasing number of patients attending to NUMA as well. Either they are referred by their neurologists or GPs, or they heard about hyperbaric therapy from another migraine sufferers who happen to be one of our patients. So we do have increasing number of patients looking for a solution, attending to NUMA to implement hyperbaric oxygen therapy. So when I see these patients, and obviously that as being not only just as being a doctor myself, but also having the first-hand experience as a sort of suffering from migraines for a long time. So that I'm very happy to offer hyperbaric oxygen therapy because the hyperbaric oxygen therapy reduces inflammation and increases the oxygenation into the brain, and a lot of people do benefit from hyperbaric oxygen therapy, course of hyperbaric oxygen therapy alongside their conventional treatments and other lifestyle optimizations. But I know very well that it just requires more integrative approach. And so when I came across with your book, and I just thought to myself, I wish I had that book about 20 years ago. So just very briefly, I'm going to touch upon into my personal history, and then I'd like to start asking you questions from the book. So as I said, I just had a mild head injury when I was a second-year medical student. And then I then developed chronic headaches and tension headaches that turned to intractable migraines, and into the extent that I used to have like 16, 17 migraine attacks per month. And in between, obviously, I was in post-ROM and sort of still trying to recover from the previous migraine episode. And there was then time to have another migraine episode. So it just took quite a long time. And it was a very frustrating experience in a way that, because I thought that I had a very healthy lifestyle, and also I was frustrated not knowing the cause of my migraines as well. And I was looked after. I was super lucky to have amazing neurologists, consultant colleagues, because I just worked in London's best university teaching hospitals when I was training, so I had the access and I was really looked after well. But so the conclusion was like there's no cure for migraines, and then I was advised not to look for a cure, but like accept my diagnosis, try and manage, and I just showed you just before we started, and just my clinic letters that listed everything pretty much exists under the sun, including two Botox injections. Then I was also offered an occipital nerve block as well. So obviously it just works fantastic for some patients. Unfortunately, it didn't work for me. And I became sort of like more and more unhealthy in a way, because that I ended up using lots of non-steroidal anti-inflammatory drugs, and then the painkillers, and in order to manage my migraines and get on with my trainings in life. So, and then I decided, having exhausted all the any preventative medications and acute medications as well, then I just decided to look outside of the box, and then to help myself. This is how I ended up doing nutrition course, and then and quite a few years of conference hopping and courses. But you did a beautiful job summarizing it all, and I'm just definitely going to be recommending to all of my patients. But so I'm obviously very passionate about the subject, what I like to do, I like to ask you questions about, give a bit of a background about what migraine is, and maybe talk about a little bit of neurobiology of and migraines. But I'd like to focus on all this beautiful summary that you just made for the patients. And you summarized the science so well and just made it so accessible and for the patients. And I'm hoping that focus on how people can help themselves. And hopefully, and your title is interesting. You just said break free from migraines naturally. And whilst, as I said, I was advised to accept the diagnosis quite several times. And that was a long time ago, and I think this is changing now, that we do know that lots of lifestyle optimizations that we can do. So what is migraines? If you summarize, sorry for my long introduction.
Thank you so much for your kind words, and thank you for sharing your story. I remember when we first met, you sharing it really touched me, because I think you illustrate the kind of suffering that people have with migraines and the desperation, and hence, searching and looking for things that will help, which is why I wrote the book. In my practice, in my clinical practice, I see people with migraines, and when I start sharing these concepts, it's for them like a revelation. Never heard of it, and they go away and try it, and it makes huge difference, and that really touches me, which is why I wanted to write this book to share more of it. So thank you for your kind words and for sharing your story. Your question, what is migraine? It's a neurological condition. So it's more than just headache. Some people think of migraines as the very typical kind where it's people recognize it as they have severe pounding pain, they're vomiting, they have to shut the lights, go to a dark room, sleep it off. So that is the very widely known picture of migraines. But it's more than that. There are a lot of people who may have other non-headache symptoms related to migraines, and for some people it's just an ongoing leftover of the premonitory or the warning phase before the headache, or the post-headache phase of migraines. So it was really very nicely summarized by some of the researchers. One of them I quoted in the book, Professor Goldsby, who I love. Yes. He taught me a lot, and amazing in the world of migraine. So he talks about it as a sensory processing integration. So you probably paraphrased it better, because I quoted him in the book.
Yes, you quoted, and you just essentially, and he just really sufficiently summarizes what migraine is, as you said. Migraine is an inherited tendency to have headaches with sensory disturbance. It's an instability in the way the brain deals with incoming sensory information. And that instability can become influenced by physiological changes like sleep, exercise, and hunger.
Yeah, so, absolutely. It's that whole dysregulation of sensory processing. And the thing is, it's genetically, people may be genetically prone to it. And sometimes the tipping point happens when various factors environmentally in their physiological state or the environment it just tips them over to getting migraines. I oftentimes use this example of a boiling pot of water.
Totally, yes.
So I give the example where when people are getting migraine attacks, it's like the boiling pot of water is overflowing.
Totally, I understand.
And in order to stop it, you could pour cold water that will just simmer it down so it doesn't overflow. So that's like taking, for example, painkillers. But you can't keep pouring cold water on top, because it would just overflow again. And really the thing to do is to turn down the fire. And the fire would be various factors, which is the kind of things I covered in my book, the actionable things that people can do to stabilize the system, so that it's less likely for them to get migraine attacks. Or in other words, they turn down the fire and it's less likely for the pot to boil over.
Totally. And it's just very interesting what you say, because a lot of people, and certainly I spend quite a bit of time and try and identify a one cause, and which is never the case. And as you said, like there's usually multiple factors involved. if you are sleep deprived, which was the default as a trainee doctor at the time. So if you're exercising and maybe slightly like over-exercise, I mean, everyone's threshold is very different. But if the physical activity can be your trigger, and you're consuming a lot of caffeine and or some other sort of triggers, and they're sort of like almost like orchestrated together, and sort of like, as you said, that you're somehow then develop the migraines and as a tipping point, as opposed to there's one single factor. So the it's again that I'm going to quote your book, and I really love this part. And you just said, during these attacks, and the brainstem becomes overwhelmed and is unable to regulate sensory signals effectively, and leading to an inability to filter out or ignore normal sensory stimuli. It's like someone cranked up the volume on all your senses to an unbearable level. Intense light, loud sounds, and potent odors, and things that wouldn't normally faze you suddenly become excruciating and triggering. So, which is so true. And again, so briefly mentioned to you that, and majority of the time, and I find the doctors and neurologists that I've seen, and then they were just understandably they're trying to help me with the headache parts. But all the sensory overloading issues and can be as debilitating as the headache itself. And absolutely that you're that you were spot on in just saying that lots of sensory overload issues that usually just before the headache starts, all of a sudden you can't get into your public transport. Everything smells, everything like somebody's aftershave triggers your migraine, and or just passengers sitting next to you, or just like it's just even nice perfumes or anything that wouldn't necessarily cause anybody any disturbances, and then can really stimulate the migraines. The same with the lights as well. And Professor Goldsby mentioned in one of his talks again, he was just saying that often it confuses patient. On the premonitory phase, we will talk about the patients can, like the light can trigger, so the light start disturbing the patient. This is the premonitory phase, and then you go into the headaches and mistakenly think that light is sort of one of your trigger. So which can be, of course, yes, but also it can be very confusing.
That's right.
And could we talk about the stages of migraines? And I think it's really important for patients to understand on the premonitory phases and what people experience in headaches and postdromes.
Yeah, I think the stages of migraine is useful for people to understand so they feel empowered, because yes, when the headache is happening, it's obvious for when people are feeling the pain, but the other things that comes before, like the warning phase or the premonitory phase or the after the headache phase or the postdrome phase, they may have a lot of symptoms without the headache being there or not so prominent. And for some people, I see quite a few as well who have migraines, but the headache is so minimal that they didn't even realize that there is that phase until they observed it, because the premonitory or the postdrome phase symptoms are just so prominent. So it could be symptoms that could start with either they have some cravings. So sometimes it's, as you are saying, that it's hard to know whether, and some people, they have a way to figure it out, through a more targeted approach. But it's hard to know whether for some people the craving for a specific type of food is part of the premonitory phase, the warning phase before the migraine attack, the headache attack, or whether it's actually a trigger. And then, but for me, I think the thing that is very debilitating for the people who come to see me would be the other things, like they are not thinking as sharply. They feel like their brain is a bit foggy, or their mood is changing. They feel irritable. They, all these things that just affects their well-being and their ability to be present, to be engaged with their family or at their workplace, to not feel as sharp or as, those kind of things that's just harder to describe. It's part of the migraine, whether it's the warning or the postdrome, and sometimes the postdrome could go on for a few days. In my book, I shared the typical duration, and for some people, it's much longer. So it may not be, 90 minutes it may be going on in terms of the after effects. It could be
48
some
hours.
days, exactly.
Yeah, so 72 hours and even.
Yeah, and I think sometimes for people to understand that is empowering because they know that, okay, I'm having a migraine attack now, so I've got a headache attack. I'm just going to cancel this important meeting or this social engagement that's happening that evening because various things. So they understand their body much better.
Then, as you said, some people, like, again, sort of like predicting your migraines, and I think it's sort of, it creates a lot of anxiety among the patients, especially who have busy life and they want to get on with their life, like myself.
Yes.
So on the pre-monitor phase, it's interesting that some people do develop extreme tiredness. I was one of them, and then yawning, tiredness, increased urinary frequency. And cravings and strange food cravings and salt or coffee or something sweet and like chocolate, and which shows again is that I don't want to go into neurobiology, but it shows again the involvement of the hypothalamus and dopamine and the neurotransmitters, and you can't really help yourself with these with these symptoms, and sometimes it was interesting for me, for example, that sometimes with the premonitory phase I knew exactly I was about to have one, and sometimes you don't end up having migraines necessarily. It's almost impossible to know.
Yes, that's right. Sometimes they kind of gel into one, and for some people, when they know, for example, they start going, oh, I'm making spelling mistakes when usually I wouldn't, or they just feel like they're yawning a lot, or just feel, starting to feel a bit slower in their brain, then there may be some strategies they could take. For example, they can start doing some breath work, or they can actually do close their eyes for a 20-minute, whether they fall asleep or they go through a mindfulness body scan type meditation or yoga nidra type meditation or other vagus nerve activations, just to balance the system a little bit, and it just gives them that window. Or for example, if somebody has got a very important project, instead of pushing through when they are having this pre or post migraine phase, to just know that, okay, they need to take a break now. Tomorrow they can finish it much quicker without feeling like they're just pushing through and not quite getting there. So it's that empowerment, I think, is important.
It's true, but also I think there's a lot of guilt attached, and so like either you then, and when you end up with the headaches, and I see among my patients as well, and especially as I said, with the personality plays a role as well. It's interesting that, again, I don't know how statistically significant, but I do see a lot of patients, and my neurologist used to say to me, and it happens to intelligent people, and it happens to people with busy minds and etc. I'm not sure how relevant that is, but definitely the personality roles, and people don't want to miss out life, and especially if it is happening on a too frequent basis. So when I started reading about looking for a solution outside of the just the conventional pharmaceutical interventions, the books, just obviously with well-meaning, but that is sort of like the advice was close the curtains, just lie down and sleep. And that sort of things, and obviously it is fantastic, and it should and it could be applied, but if it is happening too frequently, you want to understand what else you can do, and to prevent getting into that stage, but you're literally having that every day or every other day. And so but yeah, it's just that's what I wanted to point out, and literally almost all patients that I see, and they're giving the same narratives as to they don't want to miss out, and that's why they just sort of like push. But when they end up with bad migraine episodes, then there's guilt associated as well, and kind of like maybe I should have rested, or I shouldn't have that chocolate or caffeine or whatever.
It's difficult.
So it is difficult, but it is staggering to see this the incidence that I didn't know the incidence. It was actually so that common. It affects estimated more than 10% of people worldwide, and across the globe, more than 1 billion people experience migraines every year. On the research suggested, and 1 in 7 people suffer from migraines. So it's quite common. Obviously, that probably is that some people do have once a month or even just less frequently, and then there are a group of people, and then the migraine becomes so debilitating. So I'm just going to quote to your book again, and that you just said over here in your book, the searing part is searing pain is only part of the battle. The non-headache symptoms like nausea, light and sound sensitivity, and then mental fogginess can be just as challenging to navigate as well. And you mentioned about the brain fog. That I certainly, a lot of patients that I meet, they intelligent people, educated, and they mention they're not being able to find the word. Exactly. And really simple words. Exactly. And so not just anything complicated or sophisticated. And as you said, that it can happen on the premonitory phase, but also post-roms as well. Yes. And so days after the migraines, and you may still find that you have a bit of a brain fog. And so that also, I like that part as well that you mentioned. That, believe me, I understand the frustration that comes with well-meaning advice like just cut out caffeine or stop taking painkillers. So which I heard so many times from the patients that I see, but also that I heard myself personally as well. So that I think the understanding that majority of the time that I think people resort to caffeine, and the most migraine patients with migraines, and they do have sleep disturbances as well. So when you're not able to sleep throughout the night, and then in the morning you're just about to fall asleep and time to go to work, and then you're sleep deprived, and it's also that you mentioned beautifully in your book as well, that it's a mitochondrial dysfunction, and people suffer from fatigue, and they literally just want to boost themselves and just to get on with the day. And so this is probably just most people do end up having more caffeine than they should be, and not necessarily intentionally. And again, stop taking painkillers is a good advice. Definitely there's a rebound headaches with the painkillers. It's very well described in the literature, but there has to be a then strategy in how we can prevent the migraines, or how we can manage the migraines and when migraine occurred. So you mentioned that no one induces the migraine upon themselves, neither is it a psychological response to life issues or unconscious wish to fall in as an escape from daily challenges. So I like to talk about a bit more about, obviously the psychological issues and stress can be trigger and may not be the sole cause. Can we just talk about triggers? So you beautifully summarize in your books.
Yes. So I think going back to what you say about sometimes it's well-meaning with like just one thing or just another thing. And for me, it's more about thinking it as a overall system, a systems-based approach, and for the person to see how it what they can start to implement. And I think a lot of first thing to say is just having a very kind and compassionate approach to it. Because as you say, somebody may be striving to progress with their career, somebody who has a lot of responsibilities with family, and then there's the guilt, as you mentioned, and it's just difficult, so it's more of firstly getting empowered with what kind of information. So for some people, so firstly there is that bigger approach, and secondly, there can be a lot of triggers for various people, and it can be very individual. There are some triggers that's more widely reported than others, and for some people it's about experimenting with cutting out certain things to see whether that was sufficient. But by the time people listen to this kind of interview or they get my book, is because these cut out cheese, for example. I do not know. There are different kind of ways people try first. If those just single-based approach is not working, then really it's time to think of a systems-based approach. So the way I use the analogy of the pot of water. So when we think of the different aspects to systematically reduce the fire, just makes it less likely for it to overboil. It's almost like we're talking about a threshold effect.
Yes.
So the more everything is stabilized, the less likely a trigger, what used to be a trigger, could influence the migraine. So an example is like hormonal migraines. So I have some women who have very difficult migraines related to their menstruation. And it's difficult because menstruation happens for most women on a regular basis. And how do we then deal with that? And the way I found to be very successful in the people I look after would be that approach where they stabilize everything from working on the aspects related to building brain resilience to balancing their autonomic nervous system. So it makes it less likely when their menstruation is coming for them to get an attack. So there is this overall basis. And same thing as you're describing, like say sometimes bright lights could be worsening things for some people, a trigger perhaps, or maybe certain types of foods or smells, but it becomes less likely for this to become a trigger when they have all these other aspects stabilized.
And strategize a bit as
yes,
well
that's
around,
right.
especially if they can identify some of the triggers, and they may not be identified just one big trigger, but then
some common ones, for example, stress, but not necessarily the stressful period. Oftentimes it's the come down after the stress. So it's a common pattern that we see would be somebody's going through a very stressful period and the deadline has been completed, and then they go on holiday, exactly, and then they get the first few days of their holiday, they're debilitated by migraines.
Very frustrating.
Or the weekend migraines. They have worked really hard, and then Saturday comes, their body's relaxed, and then they get the migraine. So
interesting, isn't it?
There are some kind of very regular patterns.
It's very complex, but exactly. So then it just calls really, again, that I've seen a lot of patients and just gets very frustrated, understandably, that it's time for them to relax and enjoy their time.
And then they get the
and then they get the migraine.
Which feels unfair.
And so let's talk about the treatments. Obviously, I'm not going to go into pharmaceuticals. But I think it's really important, again, that I see some patients, they're extensively investigated, maybe slightly over-investigated. And then I do come across with patients, and they hardly seen any physician, and because there's a common understanding that there's no cure for migraines, and they're not being investigated, they haven't seen neurologists. And I feel very strongly about referring patients to neurologists and who are thorough neurological assessment if migraine is debilitating and frequent, and so just to make sure that we're not missing anything. So then for the pharmaceutical intervention, it is the beyond scope of this talk, but what I like to focus on, the lifestyle interventions, and obviously the pharmaceutical intervention, sometimes it's just one simple like beta blocker that just works wonderfully for some patients, and or some patients do have very infrequent migraines, and then they have either one of the triptans and sumatriptans, and just works fantastic. So definitely it is worth seeing a neurologist and exploring all your options that I advise to my patients, and including the pharmaceutical intervention, as it is very individualized, and we won't be able to advise on the pharmaceutical intervention here. But let's talk about the optimizations of lifestyle factors, and I think there's lots can be done.
Yes.
And then again, I'm passionate about that maybe, that we don't want to promise any cure to anybody for sure, but also I think it's important to make people aware that there's so many things that they can do, and that without necessarily any side effects, it would sort of benefit overall their well-being. So that you summarize beautifully in your book, and as I said, it would be amazing if I had it 20 years ago. I'd like to start with sleep. So you mentioned about and what patients can do for the sleep. Can you just talk about this?
Yes. So sleep is one of the first ones I start with to help people get into a stable pattern, because we know there's so many benefits to sleep, and that includes memory, integration, but there's also the clearance of toxins.
Of course.
So when people are in
During
good
sleep,
quality
detoxify.
deep sleep, yeah, exactly, there is a flushing out with the lymphatic system. And there are also phases of sleep that's really important for emotional regulation, and that feeds into increased resilience and avoiding the ups and downs with the post, we talked about the coming down of the stress period, like the weekends or holidays, getting migraines. So there are lots of ways that sleep would be very fundamental to this, including also inflammation and energy pathways and oxidative pathways. So in practical terms, I first talk about the importance of regularity of sleep. So that is probably one of the most common difficulties in modern living. Absolutely. With people waking up very early on weekdays, and then on weekends they try to catch up, sleeping in for 3 or 4 hours. But that can inadvertently create a dysregulation of circadian rhythm. The circadian rhythm is the inner body clock for the body to know when to wake and when to sleep. And having a regular circadian rhythm really improves the quality of each stage of sleep. So for example, the quality of the deep sleep or the quality of the REM stage of sleep. So there are different stages and they all have particular functions. So having that regular bedtime and wake time 7 days a week is really important. And I tend to say to people to question everything I say, test it out in their own lives. And first start out waking up at the same time every day and working back what time they need to get to bed so that they are not feeling too sleep deprived. Because asking somebody to wake up early on a weekend when they're sleep deprived is a big ask, and it's it's understandable that people need more sleep, and there is that times when I will be helping them through to figure out what would be an optimal bedtime and wake time. And it's not about perfection, it's about most of the time.
Optimizing.
Exactly.
As much as you can.
Exactly. And for some people, we talk about actually setting aside between 10 to 12 weeks where they will just focus in on these various aspects to clear the decks, and then they find that they've broken the cycle. And then it could be that, whenever they need to sleep in, or rather if they have to be really up early or sleep late, they are less affected. They won't get the headaches after that.
And oversleeping, certainly, I think almost, just everybody says that can trigger migraines as well. Undersleeping obviously is a major trigger, but this weekend catch-ups also don't work, unfortunately. So as you said, the regularity, I think, is the key. And so we will talk about supplements as well, but in terms of improving the sleep, so that insomnia is very common with patients with migraines, and they often that I had this similar sort of approach that I was given amitriptyline and really didn't unfortunately work well for me, and sort of just I had all sort of side effects from it, from even small doses. And just to improve my sleep, it actually just as a completely cause, just sort of worsen my insomnia. Then obviously for some patients it works beautifully well, and so it's a small dose of amitriptyline, but there's so many other things that can be done. And as you said, just putting patients on a sort of maybe just more on a regular sleep pattern, but also you mentioned about melatonin, which really worked beautifully, and I wish that I used melatonin before the amitriptyline, and sort of like struggling weeks and weeks. And you mentioned about the pistachios and which is naturally high in melatonin, and I'd like to add actually tart cherry juice to it as well. So, and magnesium, and obviously then you mentioned about like sort of 400 to 600 milligram magnesium sometimes totally does the trick. And combining this, sometimes the melatonin and plus the maybe just having a bit of a pistachio in the evening, and some just a small glass of tart cherry juice and magnesium, and sometimes just patients just remarkably just say that's it, that's all I needed. And improve the quality of life and the level of fatigue, reduce the fatigue, and then it can be as effective as any pharmaceutical intervention, really, without side effects.
Yes, absolutely. There's quite a lot that I work through with people. people with the lifestyle changes for sleep, like even just on sleep. And that also includes like a wind down routine.
Yes.
And we start talking about the timing of when is their last exposure to electronics, how
That's
to turn
super
down.
important,
Yes,
isn't it?
exactly.
And blue light.
Exactly. Blue light, how to turn down like the intensity, because we know that light will block the release of melatonin from the suprachiasmatic nucleus, which is the part of the brain that is the master clock for the circadian rhythm. And there are other wind down routines that we start thinking about. It could be about a gentle walk, stretching, breath work, or journaling. And then for some people, then they may also want to add in other things such as
Like
what you
yin
just
yoga
mentioned.
and all this.
Yes.
Exactly, to the bedtime
Absolutely.
routine.
And for some people, it's actually maybe they have a busy mind. So I give little tips such as they listen to a podcast, maybe something like this one, or like an audiobook or something that they put on auto timer to stop, so that then the phone is like on the other side of the room.
Yes.
They're not on their phone until just before they sleep, because they're on social media and just activates the brain. They get the lights coming from it that is affecting their ability to sleep. But having listening to something just somehow can, for some people, very effectively break the cycle of overthinking, the thinking mind that's trying to problem solve as they're falling asleep.
And also like really sort of trying to fall into sleep. It's quite tiring.
Absolutely.
And then just it sort of like doesn't work. And there's so much awareness, like there are blue light sort of blockers, like bedside lamps, and that if people are with migraines and they prefer to read, and instead of just using a regular light, as you said, there's more awareness about that now.
Absolutely. And also the timing of when it's good to have a brighter lighting, like daylight or natural light when one wakes up. So lots of kind of strategies I share. I've actually written a little workbook, style book about for people to really get dialed in with their sleep.
To sleep. And optimizing sleep, I think, is just one of the most effective probably strategy to reduce migraines, isn't it? And then I won't get into too much of details, and there are some people, they do have sleep apneas, and that's very important. Again, I certainly referred some of my patients with very obvious history of sleep apnea without them realizing. They're always needing to have an afternoon nap, and very obvious in obstructions of the sleep, and which can be a major trigger again, and affect the sleep quality and the cardiovascular effects as well, adverse effect as well. So, but I won't go into this. And then there's restless leg syndrome, and some patients do suffer from, again, like they can be anemic, or they might just need, they might benefit from B12s and etc. And these are sort of like, that's something that maybe the whomever is interested can read from your book. So I'd like to talk about one of the other things that I find really interesting, blood sugar regulations that you mentioned. I think there's increasing awareness about this now. It certainly took me some time to understand the why reactive hypoglycemias that I experienced, and when I was suffering from migraines in the past. And you mentioned about strategies and how to reduce this as well, and you just all of a sudden find yourself and your blood sugars on a roller coaster, and it doesn't happen to only people overweight, and obviously if you got weight to lose, and it would improve metabolic function for sure. But I certainly seen people, migraine sufferers, they're looking. They have normal BMIs, normal body composition, and they can still have blood sugar dysregulation. So I don't know, I'd like to ask your opinion on this as well. You've given wonderful tips in the book about blood sugar regulations, but certainly I've seen among the patient populations that I usually just often advise people, especially the patients who clearly describe a bit of reactive hypoglycemic episodes, and saying that I just get sort of anxious, and my hands gets cold, and I'm a little bit sweaty, and then I get mental fog, and then I just sort of have a bit of a tremor in my hands, and as soon as I eat, and within sort of 15-20 minutes my symptoms better. So then they realize the hypoglycemic episodes more, but that they're not aware that actually after hypoglycemic episodes and their blood sugar also spikes disproportionately high. So because it's so available now, and then I usually just advise patients to maybe just at least to see for a couple of weeks, use continuous blood glucose monitor. And I'm not entirely sure about the usefulness of it that there are some people out there almost orthorexia level that they wanted to have complete flat level for the rest of their life. I'm not sure how necessary and that is, and how I don't think there's much evidence on this one, but certainly that patients understanding their carb responses and maybe avoiding unnecessary blood sugar spikes. Like I just like to give an example of a patient, one of our NUMA patients, a patient having hyperbaric oxygen therapy, responded really well to hyperbaric oxygen therapy, but at the same time she was having very clearly this episodes of hypo and hyper episode. So she just did a 2 weeks of continuous blood glucose monitoring and realized that her morning coffee with oat milk caused a disproportionate spike every day. And she just said, it's interesting, I have definitely less headaches and migraines now, but that I almost like get mental fog and for at least half an hour. And then she realized that it was sort of correlating with her disproportionately high blood sugar triggered by oat milk. So she sort of opted for either sort of like black coffee and just decided to have a bit of a whole milk maybe. Then and she sort of like avoided these episodes. And I think it is the blood sugar regulation that there's less. I wouldn't say understanding necessarily, but among the neurologists colleagues, that I'm not sure how much emphasis goes on the blood sugar regulation.
I talk about it all the time with my patients, really based on my experience of asking in detail. I'm really very interested in people's experiences, so I found the pattern, which is why I focus on it being an important aspect of stabilizing of blood sugar. For some people, it's not relevant. I've picked up quite a few where it's relevant, exactly as you say, and I pick it up from the kind of foods they are eating, and I have a deep interest in nutrition, so understanding that certain types of food will likely cause a sharp spike in blood sugar, and knowing at what stage they tend to get their migraine in that day, and tuning it back with types of food they have. Or maybe some people, they go, oh, I'm craving sugar now, and something almost like they need that little boost, and I also know then they will cause a crash and such things. So it started off like before there were continuous glucose monitors. I would go through somebody's nutritional daily intake,
detailed assessment,
and then I would then give a prescription of a handful of nuts with a low glycemic index fruit like a plum or some cherries, and that would break the cycle for some people as part of a systematic approach. And then with the continuous glucose monitor, I do it in selected patients, only, like I say, selected because if I think there is a situation here, and they may prefer that to just making the changes before. So I do individualize and personalize.
Unnecessary restrictions, and it has to be guided by a medical doctor, for sure.
Yes, for some people it's enough to just make the dietary changes. Some they also like to have the numbers, so I do personalize it accordingly. So so it starts off with having the question, and of course with oat milk, not everybody has that response. It also depends on a lot of things with the individual, whether it's with their gut health composition, the type of oat milk, what's in it,
what exactly
is it actually having a lot of other ingredients. So there are lots of factors that would
But by
come
the way, you're absolutely right. And I mean, certainly seeing patients not tolerating, well, not when I say not tolerating, like hugely having a blood sugar spike with certain things, then actually when they address the underlying issues, and they're not having that.
Yes,
And
that's
so,
right.
and then there's it's scientifically just proven that like some patients, especially with some genetic tendencies, that if they are sleep deprived, they would have more blood sugar spikes. And on top of this, if you're sleep deprived, and you'll be craving more for carbohydrates, and then you would have more cortisol, like inappropriate cortisol response, and that would also worsen your blood sugar regulation. So it just becomes almost like a vicious circle. So that's why it is important for people to understand, well, actually I'm sleep deprived, this is why I'm craving more carbohydrates. And yes, probably my cortisol is high as well, and this is why I'm feeling anxious, and then sort of like trying to soothe my system, maybe just eating a piece of cake. But as you said, that what are the then options and alternatives? You described it very well, and sort of you mentioned like maybe if you're having a slice of apple, just have it with a peanut butter or like a nut butter. To sort of like prevent this dysregulations as well. And then you mentioned about weight loss, obviously when necessary. Obviously we'll talk about the exercise as well. And but I think it's important to understand the importance of the blood glucose regulations in migraine as well. And certainly that I'm just looking at back again, like and lots of patients also walk in very similar situations and with a piece of blood tests and done by a colleague, and then it's just usually just the kidney functions and liver function and morning blood glucose, and off we get your results are normal, and then there's nothing else to do. But then the understanding of the blood glucose metabolism, and I certainly seen people with really borderline prediabetes, HbA1c 5.7, 5.8, and somehow before they get into the territory of this magic number of 5.9 or 5.9 or 6, and it seems like that almost like we don't have to do anything, which is not which shouldn't be the case. And let's talk about a bit of an exercise as well. And you mentioned about exercise, and exercise you mentioned in the book that can be trigger and for patients, and certainly it was my case. And I'll just tell you a little anecdote, and I hardly seen any GPs in the process, but seen a GP, and I was just frustrated and desperate. So he said to me, so do you exercise? And I said no. So well, obviously I was walking forever. I used to walk every day, but I just couldn't exercise because every time I exercise, it just triggered migraines. And obviously, it's a bit of an invisible disease. And he looked at me and just said, "You look very healthy, and why don't you exercise?" And then I said to him, "Have you ever had any migraines in your life?" And then he said no. And I said, and then I won't explain. So it's I think that now I exercise every day, and then I really enjoy exercising. Yes, the certain exercises can be still trigger, but I think that what you mentioned at the time, again, like you just it's so disheartening and trying to implement exercise. And then you react to it, your body reacts to it, and then you develop either big migraines or disproportionate fatigue, debilitating fatigue, or visual disturbances. In my case, it was just visual disturbances and bitemporal hemianopsia. I certainly had few episodes of bitemporal hemianopsia right in the gym. But then I think what you really did a beautiful job explaining that it's not like either you are fully into it or not, and you can try and find and whatever works for you. And what you mentioned it, some aerobic exercises, or maybe some gentle strength training, or yoga, or swimming, or walking for sure is the most underestimated exercise, I think.
Absolutely. And I think the key is meeting where that person is and then taking them where they feel would be the right next step. Because there are, as you say, when it's overwhelming with migraine, there may be other more better entry for them to start to feel their body and feel empowered in their body. So for some people, when it's just so debilitating, perhaps actually it's just a gentle movement and gentle breathing with the movement, like a very gentle yoga style. For some people, it's about going for a brisker walk because they may feel like they want that oxygenation to their brain, or
Absolutely.
or that the endorphins release. For some people, as they get better and better, then we start to build in other aspects. Because in that book, I shared about the different types of physical activity, from walks, moderate intensity, the so-called zone 2, where you go for brisk walk, to maybe higher intensity level type training. There are benefits to these at different time points. And for some people, when they're really very debilitated with migraine episodes, it may not be the right time for them to go straight in with the high intensity.
And certainly
yes,
they wouldn't tolerate.
because yes, indeed,
Absolutely.
and it may be that as their body recovers, they get to that level of stability, and they're then building, as they build their resilience. When the time is right, then we start to introduce other forms of exercise and physical activity.
And I think even if someone not able to exercise, other than maybe gentle walks, starting with the breathing exercises, as you beautifully mentioned on the ANS dysfunction, autonomous nervous system dysfunction, and really regulating the autonomic nervous system. And this is something that I think if one is not able to do any form of exercises, and certainly the walk, I think that a lot of people do manage, and short walks, but at the same time maybe start with the breathing exercises and to regulate the autonomic nervous system, and then maybe just go beyond, and then just do brisk walks, and then take it from there, and whatever they're tolerating, and whatever they also find a bit of joy as well.
Oh, that's so key. I'm so glad you used that word joy. I was about to say it's about finding what they enjoy. And sometimes it could be actually starting with going to the park, just going for a stroll in the park, and sitting on the park bench, and just having that sense of release.
Yes,
and then doing some gentle movement, gentle stretches, rather than going, yet another thing to do on the list, because it's overwhelming as it is to have migraines and to cope with life, day-to-day responsibilities, and then to add in, do this exercise. That is
there
a
has
lot.
to be yeah, absolutely. And the let's talk about supplements as well. And when it comes to supplements, I am sort of cautious, and as to yes, that some of the supplements obviously not very well researched, and it's very, again, the individual responses. Some patients do respond really well to certain supplements, and some people don't. And also, I'm just trying to really get all patients with migraines to understand that there's no like one magic supplement that they can use, and then they can address their metabolic dysfunction if they have any hormonal imbalances and ANS dysfunctions and poor stress responses and etc. But there are certainly, as we mentioned, like magnesium, even topical magnesium maybe also, and Epsom salt bath, and some people do benefit immensely. And you mentioned about list of supplements in your book that I like to mention, but that again, and I think my understanding is that has to be individualized, and by someone like yourself as well, and sort of that there are some patients, they obviously they do suffer from increased intestinal permeability, or another word, leaky gut, so the lots of gastrointestinal system disturbances. And for those patients, then it may be if the every sort of underlying cause being looked at and excluded by a gastroenterologist, and that they might benefit from, you mentioned about L-glutamine powder, or like to repair the intestinal lining. You mentioned about collagen supplements. You mentioned about zinc, carnosine, L-carnosine as well. I find very effective. And then some other things as well, like marshmallow root that you mentioned, and obviously the probiotics. And so that there are quite a bit of research now, just interesting research. And then I just like to mention a few of them. And you mentioned, quoted on the book, that study looked at the effects of probiotics containing lactobacillus and bifidobacterium strains on episodic migraine patients. And after 8 weeks of supplementation, the probiotic group suffered significantly fewer migraine days compared to the placebo group. And then you mentioned a few other research as well, and so with the probiotics, and probably just again reducing the inflammation in the gut, and also helps repairing and regenerating the gut mucosa as well. But I think again, going back to the nutrition, and that the diversity that in the vegetables and fruits and all this that we're consuming, and ultimately nutritional interventions, and I think I find most powerful, and then to sustain the results as well. And probiotic can be a good start.
Yes.
And about the making the nutritional adjustments.
Absolutely. And I always say food
and
first.
You mentioned quite a lot.
Yes. Food first if possible. That's a general rule of thumb would be whole foods if possible, avoiding ultra processed food where possible, having a huge variety of plants, different types of plants, which could also include spices and herbs and a whole variety to really nourish and build the gut health.
Absolutely.
And then, also I like to recommend fermented foods because it has the natural probiotic, which would be what probiotic I tend to describe it like the healthy bacteria. And the prebiotic, which is like the fertilizer, like the fiber that comes with it. So things like, and different people have different preferences. And also the key thing is to introduce fermented foods very gently. For some people, it may be a lot. They may react to it, exactly. Yes. So it's about just gently bringing in some of these foods. And if where possible, I always recommend food first.
And nutritional interventions need to be individualized as well, as you said, and that because if someone has got dysbiosis, certainly they do respond so well to probiotics and prebiotics and prebiotic food and fermented food. But at the same time, if someone has got small intestinal bacterial overgrowth, and these really healthy foods and can really trigger small intestinal bacterial overgrowth symptoms, and plus that sometimes the SIBO, when SIBO gets really worse, and then the patient do report increased frequency of the migraines or severity of the migraines as well. So that can also needs to be sort of advised by an expert, and which state and what to introduce, and really. And so the gut brain sort of that is just more and more recognized now, and which, as you said, that the nutritional interventions is very important on the long term as well. And you mentioned also the importance of the hydration, and I think
what are
example,
the tips?
I'm not very good with this, but I'm just trying. And so but the hydration is super important as well. Obviously for the patients as well. You mentioned about again like really making maybe an effort, and then also sometimes electrolyte imbalances that not necessarily be suggesting that everyone should be supplementing with electrolytes, but some people do really benefit from electrolyte supplementing with electrolytes as well.
Yes, I always say kind of sips of water throughout the day, avoiding foods, fluid containing sugar or artificial sweeteners. Sometimes natural things like coconut water, for example, is quite nice, or eating hydrating fruits, for example, watermelon. It's got the benefit of hydration and the fiber. Cucumber, having water with mint leaves in it, and kind of has all these benefits of including for the gut health, and also that it just feels refreshing. Amazing. So I would say definitely these would be really very helpful.
And the other thing that I often see, because the gut symptoms are associated sometimes on a premonitory period as well, and there's lots of bloating with some patients, and or tendency to have constipations, etc. So that lots of people without guidance, and then they go for eliminating the foods, and then nothing wrong with eliminating a particular sort of like food group maybe, and then see what your response is going to be. But ultimately, if you restrict more and more and more, then the diversity, we affect the diversity of the gut microbiome, and which is not necessarily good for the gut health and overall health as well. So because, as you mentioned in the book, so we are metabolizing the certain vitamins and obviously in the guts as well through the gut microbiome, but also that significant portion of the neurotransmitters are produced in the gut as well. That all happens on this ecological environment that we really want to keep it as wide and diverse possible. And so that I think that if the teeny bit of advice that I can just give from here as well, just definitely seek an advice, and before you go to sort of like having a very restrictive diet and then completely excluding certain foods and for quite a long time, and absolutely makes sense. And if there's a SIBO, that yes, that might just help going on a low FODMAP diet. And if some patients do have significant and severe histamine intolerances, that it can make sense sometimes whilst you try and address the underlying causes and like the repairing gut lining, and maybe avoiding and reducing the histamine-induced, histamine triggering food. But then ultimate aim, and I think should be really and try and normalize the diet and just make it as wide as possible, as healthy and wide possible, as you mentioned in your book as well. There's lots to talk, but I am aware of your sort of time. What I'd like to just mention, last few things, that could you tell could you talk a little bit about breathing exercises that you mentioned, which I find fascinating. And you got another book, which I'm hoping that we can just talk maybe another time, Mindfulness for Brain Health. It's really fascinating. By the way, a lot of patients do read this book whilst they're having their hyperbaric sessions. I read it when I was having the session as well. So it's very interesting because you can hear your own breathing. And it was really nice. Amazing. But you just amazingly like summarize what patients can do to regulate the ANS, autonomic nervous system. So could you just give a few tips about where to start from? Not everybody can meditate. Some people are super good at meditating, some not. But I think everyone can do breathing exercises. And what would you advise as a sort of like starting point?
And I think, we always have our breath with us every moment. And sometimes it starts off with just tuning in with what we are observing. And it could be as we are sitting, we are just observing the movement of our breath. And sometimes some people, they just put their hand where they feel it, whether it's their abdomen or their chest. And sometimes I advise to kind of have both their abdomen and chest. And I also suggest that sometimes they feel it at the back. So it's become a whole kind of cylinder-based opening and closing. So that could be a starting point where you just observe the breath. And to build up, it could be then taking in a breath, counting how long it takes, pause for a few moments, and as they breathe out, counting how long that it takes, and then pausing for a few more moments. So it starts off with observing how long, what the body is doing in the first place. And then I get them to start to increase the length of their out breath.
Exhalation.
So there are various counting methods. So for example, there is a count of you take 3 counts to breathe in, you hold for 2 counts, and you breathe out for 6 counts. Or you take 4 counts to breathe in, 3 counts to hold,
and then 7.
And you take So the general rule of thumb is that they take longer to breathe out than it is to breathe in. And it's actually about slowing down how quickly. So it's the same amount that comes in and out. It's just that when people breathe out, they just slow down how long it takes. And I always advise that they have also a pause after they breathe out, just to avoid people over breathing, meaning they reduce their carbon dioxide too much, or hyperventilation situation. So kind of breathing in and then holding for 3 counts, and then breathing out for 7 to 8 counts, and then hold again for another 3 to 4 counts.
Prolonging.
And I put various variations in it.
Especially on the mindfulness book. And it's just
Absolutely.
Then I think that one can again experiment and then see what it works. And also sometimes even the same person just might actually find, depending on what you were having at that particular time, and the level of your mood and anxiety and the headaches, and one might work better. And then next time and something else might work better. But it's just important to, I think, experiment and really. And then it's interesting that what you mentioned about also maybe placing the hands on the chest and then and abdomen. And I, when I was working in neonatal intensive care, and sometimes we had obviously the babies in the incubators with a very elevated heart rate, and clearly, and then they're stressed. And we used to do this and then sort of place one of our hands on their chest and then one on the forehead, and then you can see on the cardiac monitor how their heart rate settles.
Yeah.
So it's just interesting just to learn about these and really regulating the autonomic nervous system.
Yeah.
So it's amazing. Now, so I know that you are just doing lots of education in different forms and for public. And can you just tell us how people can reach you? And then also you have this mentorship program as well, which I think is amazing. And so it's an amazing guidance for anybody. And also I mentioned to you, I think it'll be really helpful for doctors as well. And I encourage all my colleagues out there to read, and anyone who sees in any form like migraine patients, the GPs, the neurologist, so because it is difficult, especially even in NHS settings. And I worked for years in NHS, and so you really want to do the best for your patients, but then you've got 10 minutes or 15 minutes. But it's accessible, and then I think that it's an amazing guidance. The mentorship programs, yes. I think amazing, and because then again, you listed all, we don't have time to go through, yes. But you're given all these nice tools about the apps that patients can track their symptoms, and you mentioned about all the other sort of like the other resources yes. might be helpful as well. And I'm interested in how your mentorship program works. And then also you mentioned about your newsletter, which I'm definitely going to sign into. And so Thursday sort of bite-sized
tips.
Yes, Thursday
bite-sized brain health tips to thrive.
And we will definitely give it on the sort of on the below, so the email address and where to sign into. But how does the mentorship program work?
Yes, the mentorship program is really like a little container of 12-week period for people to feel supported as they start to implement all these lifestyle changes in a systematic way. And oftentimes there are questions people ask me about how they individualize it for themselves, or they may be facing certain challenges with some implementation. So I'm there to guide. So it's a 12-week program. It's a educational based program. It's an educational mentorship program.
Amazing. Is it one-to-one or is it a group of patients?
It's in a group, yes.
It's in a group, even
and
better in a way that people can share it.
Absolutely.
Exactly.
That's what
it's isolating enough, and then it's sort of like
absolutely.
when people are able to listen to each other's experiences as well and learn from each other's experiences, and it'll be amazing.
Yeah, that's I feel so touched whenever I facilitate groups. I do a lot of group care models, whether it's for their care on the NHS or in my research setting or in my mentorship online educational courses and mentorships. And there is magic that happens where people feel that, all right, they are not only not alone, but they also learn from other people's experiences. And it's just such a privilege.
Absolutely. And also that, again, like I'd like to mention that what you said, that you mentioned about nurturing your brain resilience and by restoring balance to your autonomous nervous system, the control center that regulates key bodily functions. And so with this mentoring program, and obviously that, you know, we touched upon that I think that hopefully people not disheartened and just try one thing and then that doesn't work for them. And like, you know, I certainly heard, you know, quite a lot and from patients just saying I used that supplement and it really didn't work for me, didn't do anything to reduce my migraine attacks, or like I tried yoga, I tried breathing exercises, it's not. But I think it's just having it as a sort of looking into person as a whole, looking into is there metabolic dysfunction? If there's a metabolic dysfunction, you also need to address the metabolic dysfunction as opposed to just the breathing exercises. Might be helpful, reducing your cortisol and ANS function, but at the same time, food and the nutrition and will just play an essential role and regulating the glucose metabolism and hopefully then reducing the migraine episodes as well. And you mentioned addressing the gut. If someone has got major gut issues, dysbiosis, increased intestinal permeability, then it's very important to address and important to address in all these elements as opposed to looking for only one intervention, and which I think your mentorship program and it would be amazing for that and as well. And then also the book, also what aspects that needs to be they covered and what aspects needs to be explored, which I think is amazing, and is an effort to obviously put this all together, but the guidance is there, and I'm so grateful that for your time, and then you explain this all us, and I'm just be really extremely helpful and for me as well, and helping out patients attending to NUMA for hyperparagogic therapy, and it will be in our library for sure for our patients.
Fantastic.
And thank you so much again for coming, and I'm hoping to have you back again, and just to talk about the mindfulness book. And just we touched upon, but it'll be amazing to talk a bit more in detail as well.